I guess I just don't get your point. But we can talk about it over dinner maybe.
Okay, all right. So yes, let's take up this question. Yes, and I think that's a very complicated. Yes. All right. So let's take up this question of how, what are directions that you think would be the most productive in terms of applying the temperament research? I mean, that's kind of a summary of what you're saying, right? How
Yes.
can we take it and make it portable, make it genuinely useful in applied context? So Sandee was actually going to start us off on that last question, so would you mind taking that one first?
Well, I admire the fact that you're a good consumer of research, and I think that's an excellent beginning, and that researchers also are obligated to make their findings more translatable to people. But one of the things that I think we need to look at is when we're talking about some of the important results that we have, and we're using self-regulation at some point as part of temperament, and another part as a process, and then as an outcome in another one. And we do the same with emotional regulation. I don't know how anybody can be a really good consumer of research with as much conflict as we have among ourselves in terms of what this means for the real world. So that's one of the points. And when we, as we start doing intervention research, and certainly all the work that Cameron has done and others have done is a very good beginning. But services these days for children have to be evidence-based. And we need to get temperament-based intervention that is empirically supported if we're ever going to get any support for this. And not until then can we say that we are developing as a body of knowledge that comes to the kind of outcomes that you want in terms of how do I translate this to real people with real kids. Now that's, you know, as much as I frequently write, we don't have enough temperament-based intervention that is empirically based. We're not alone in that. And I think all of the major constructs are very, very far behind. But it's something that we need to lead ourselves towards. And one of the things that struck me when I read the 87 paper, and other than the fact that it had been so long that since I had read it, is how open the experts were, that this was not a closed discussion by any means, and that they weren't sure. But what kept coming over, and this was Rothbard and Chess and Thomas particularly, how open they were to, this is the important part, this is not the important part. When Stella says, you know, we're going to argue about how many dimensions there are and all that, that's not the important part. But what is important is that we continue to differentiate what it is we're studying, and under what circumstances, like Susan's presentation, elegant presentation, under what circumstances does this mechanism work for this particular child? And we need to continue to look at it and not to give up and say that these are the end results of what we have, but to continue to explore in deeper and deeper ways how children are influenced by different caretakers and what we can do to support those caretakers, whether parents, teachers, therapists, or whatever, in helping children to be more adaptive.
I'm gonna let me try answering this question just for a minute too, because this sort of thing is very important to me because I'm a clinical psychologist. So I mentioned the DSM-5 a little bit ago. There's a big potential change in the whole DSM-5 that involves the real incorporation of individual differences in personality, and so to me it means also the incorporation of temperament. And it's I'm a consultant to the work group on personality disorders, and there's thinking about adding personality trait dimensions to that. But there's a more general sense of wanting to include individual differences in the diagnostic manual, and I mean beyond just diagnoses, of course. And so I think that this is a really exciting opportunity for temperament researchers to have a chance to influence the development of more interventions that address kind of extreme and potentially interfering temperament traits that children have. So just one example, you know, there's a lot of debate, I'm sure you're all aware, having to do with bipolar disorder, diagnosing bipolar in children. And it's become a very prevalent diagnosis. People have started using these very heavy-duty medications in very young children. And one of the debates for DSM-5 is about, should there be some other diagnosis used for kids who have some of these intense emotional reactions to things that is not bipolar. And actually, I think they are moving in that direction, trying to avoid the bipolar diagnosis for kids. But what it means is that we need some other set of interventions to use for these kids who have these extreme emotional tendencies. There was this article in the New York Times a few weeks ago that was just horrifying about parents whose kids have been diagnosed with bipolar having their kids put on these heavy-duty medicines. And to me, it was so obvious reading the article. These are kids with just extreme traits, and the parents were desperate for someone to give some sort of explanation for it. And so they just attached to the bipolar diagnosis, but then really didn't find the treatment useful in helping. And there are parents who would have benefited so much from some sort of structured approach that said, look, your kid, there's nothing terribly wrong with your kid. Your kid is just extreme in these ways. Here are things that have been found useful. And I think there's enough research on goodness and fit now, maybe not quite enough, but there's a lot that would be a great starting point for trying to develop those kind of interventions. Yeah.
Now, Peter Jensen's,
Could I react to that?
Sure.
From a clinician and a maid, it's okay?
And a male?
Yeah.
That's all right.
I think that in our society, though, and I'm on the clinical side and still all the time, is as parents that bring children in and they want to fix.
Yes.
They want to fix fast, and they want to fix the mess. And they don't want to spend any effort in learning how to improve the goodness of care or some of those conditions. So I
Or it
think
hasn't been offered to them as a viable alternative, right? They've been taught that
well, and in psychiatry,
Yeah.
the whole psychiatric movement is really being managed.
yeah.
We have to rely on the clinical psychologists to do that, to talk. But I agree with you.
yeah, I wanted to say, Peter Jensen's book is just really excellent in terms of talking about how you cannot talk about a child's disorder without looking at the context of the family, and more importantly, that we treat these things in terms of the same symptoms, that the diagnosis is not as important as the symptoms, and that many of the treatments are very, very similar, no matter what the diagnosis that is attached to it, which I think is what you were saying.
This is part of what I'm saying. There's a whole movement. It's much more focused on adults than on kids, but trying to develop trans-diagnostic approaches to dealing with basic underlying patterns, which then leads back to temperament and personality, right? Because that helps to identify the patterns. I mean, the idea is that you don't need a million treatments out there. You just need a certain number that can cut across common patterns that you see.
I think, when we talk about applications, I think one element that is very important is the mechanism. I mean, if temperament-based intervention has some benefit, then what are the mechanisms? And I think one issue is the whole question of etiology. Does it help the parent to know that it's not their fault, and it's not necessarily their kid's fault, but it's a good fit? So it's all about interpretations. How do you interpret a given set of symptoms? And is that a potential mechanism why temperament-related based intervention does work or could work? It sort of takes the blame of the
Right,
parent,
it takes-
and that induces relief, and that then sort of puts the parents back into a blank slate in which they can sort of start fresh and look at the symptoms more positively.
I think we call that, it takes away the intentionality of it, and then we can refrain for the parents, take away their energy in terms of fighting the kid's temperament, and then work with us in terms of matching strategies with them.
Yeah.
There's a lot of talk about intervention, and especially for children who are having difficulties in the parents' life, but it's interesting to think that children outside the home, the place they spend the most time is in school. And so it's really curious that as much as we know about temperament, David, as much as we know about temperament, it is not at all a typical part of teacher education. Teachers don't step in the classroom with knowledge about temperament, and we expect to see unfortunate misapplication or non-application.
Right, and I agree. I get my kids' report cards for the elementary school, where they actually have ratings that to me are basically a temperament rating. You know, so it's things having to do with attention and you know, various things where it's like it's an outcome that the child has total control over, right? That we can grade the child on these things. And so to me, it just shows a misunderstanding of what they're rating, right? That they think it's volitional on the part of the child. Okay, other ideas about interventions? Oh, we had another question. Yeah,
Just another
Helen.
comment on sort of the cycle of intervention. One of the favorite things that I do is I teach a 6 weeks class for parents of spirited children. So the parents do a profile of their child, and I ask them to do a very rough profile. It's not the formal adult questionnaire, but a rough rundown of their own temperament. And partway through class, what the parents start saying to each other, once they've identified, thanks to Mary Krasinka, has a wonderful exercise of inviting people to line up according to their own adult traits. So you end up with all the intense parents over there, and they get to know who else are the intense parents. And pretty much, and as class goes on, they're saying to each other, you know, I notice that if I manage to clamp down and keep myself from exploding, my kid is calm. And it's coming from parent to parent, from them starting out talking about their child's temperament, seeing it in themselves, and they're choosing to make a behavior change in their own behavior. It's a wonderful process to watch.
All right, any other question on this topic? Yeah.
I guess my question is a conceptual one in terms of the goals of the interventions. Could we look at some immediate goals, such as by soothing someone or changing, improving the fit, but long-term developmental goals, so that if temperament is seen as problematic in terms of disrupting the long-term development, then do you have a sense that interventions have been ordered or organized in that way so that what changes now is tracked to see that it changes development down the line?
No, we don't have enough, we don't have interventions that have been going on that long to see what's going on. We have a lot of basic research or developmental research that can give us suggestions for what's going to happen. But we really do need interventions that are long-term in order to do that.
I mean, I think it parallels the therapy research too,
Right,
right? Where
right.
I think over the last decade or so, people have really started to track the outcomes much more long-term than they used to. And so you sometimes see in the therapy studies these profound changes that seem to last for quite a long time. But I don't think that the temperament interventions get this documented.
No, but when you look at Kellum's work, and you see the work that was done in first and second grade, and these kids are now young adults, and they can trace from the early intervention of goodness of fit, not goodness of fit, good behavior gain, that the kids who were in classrooms, these were classrooms that had this in first and second grade, less drug use, more graduation, real long-term benefits that were never intended, but which influenced the children by changing that early trajectory during those very critical early years. And I think there's enough evidence to support that if we do that, particularly with, we would hope that with parent-child interactions and teacher-child interactions in the very early ages, that may follow through. But I certainly would be willing to take lots of money to continue that. In case anyone is.
Okay, I want us to have time to do these last two questions. So, so let's backtrack slightly. Okay, so go back to the question of: are there previous convictions about temperament, especially from the 1987 paper, that have been modified or rejected on the basis of your work? For this, we did not decide who was going first, so you can. I'm sorry. No, please do.
I decided. This is easy for me because Buss and Coleman, their view of temperament was that it's early period and it shows a genetic influence. And because impulsivity did not show a genetic influence, they had originally had it in their temperaments. They had emotionality, activity, sociability, and impulsivity. Just these